Narde. Narde.
The. Hello and welcome to Health Live at Seniors Today. If you saw the montage in front of you just before I started speaking, you saw our guest today who was here with us in late 2021, and she's back here with us, and she will speak on dental concerns amongst the elderly, amongst the aging. And I will introduce Dr. Asha Narde. She is a conservative dentist and an endodontist, and has been in clinical practice in Juhu in Mumbai since 1995. She graduated from the Nair Hospital Dental College in 1990 and subsequently did her post-graduation from the KLES Dental College in Belgaum. Dr. Asha Narde is a consulting endodontist at the Center for Advanced Dentistry, which is at Beach Candy Hospital for the last 16 years, or perhaps now 18 years, and has been working alongside Dr. Rajiv Narvekar in South Mumbai. A great majority of her patients are 60 years and above, and providing optimum dental care has been her mission. She is part of the fraternity that trains young dentists in the field of geriatric dentistry to understand and provide the needs of the aging population in an objective manner. Welcome once again to Health Live at Seniors Today, Dr. Narde. How are you? I think you're on mute. I think you're on mute. You're on mute. Yeah. How have you been? And
yeah, I've been good. Thank you so much. Good evening, everyone. It's a pleasure to be back again. So I would say post-COVID times, because I came in the midst of COVID and I was giving tips about how to move through during COVID times. Well, all that's way behind and we have a new outlook. Life has become much more rushed than what it was before, but certain principles and certain disciplines for daily healthy living are still to stay.
Absolutely, absolutely. I think those things are there. We have to be, now one is aware that one needs to be a little more careful than ever before. So the topic that we have, requested you to speak about is oral dental concerns amongst the aging. And what I'm going to do is I'm going to request you to speak about it, make a presentation. And those of you who are here, please ask your questions in the Q&A tab. Mention your age and your gender if that helps, and I will then pose the questions to Dr. Narde. Over to you.
Thank you, Mr. Maheshwari.
Yeah, we can see it.
Yeah. Good evening, everyone. It's a pleasure on a Saturday evening to talk to you, a topic very close to my heart. These days, I speak more among our dental professionals, trying to create an insight among them as to how we need to move ahead with our aging population. So this is a welcome break for me. I have 2 seminars lined next week only among our dental fraternity. So it's what I learned from y'all on a day-to-day basis, which I take to my dental professionals, my colleagues, my seniors, my juniors. So please be free to share whatever doubts you have, because it's only when we deliberate that life becomes much more easier for both of us. So here we go. So population aging is one of the greatest global accomplishments, is what I would say. And this is the outcome of all the technological growth, the improved healthcare through better diagnosis and treatment, and better healthcare services. And the new elderly are much more aware and more educated about their social and health services than the past generations. And many among the elderly want to preserve their teeth much more than wear complete dentures. So if we look at certain population studies, the world population as of now is projected to be 8 billion as of 15th November 2022. And this is believed to rise to 9.7 billion by 2050. The population of our country is 1.4 billion, and we have become the most populous country on the planet. So in this population, the elderly population in India right now is around 8%, that is amounting to 80 million, and is expected to reach 12% by 2025. So by 2025, one out of every seventh elderly person in the world will be an Indian. And if we look at certain population studies of our country, we see that more than 50% of the population above 50 years are medically compromised. And in this, 27% of the population have at least more than one comorbidity. 24% of the population have difficulty performing their daily functions, such as walking, eating, visiting the toilet, according to the survey. 40% have some kind of disability, and 20% of them suffer from mental illnesses. The commonly seen health issues are diabetes, hypertension, cardiovascular disease, arthritis, cancer, degenerative neurologic and neuromuscular disorders like muscle atrophy, Alzheimer's, Parkinsonism, myasthenia gravis, chronic obstructive pulmonary diseases, and gastric issues. But in the middle of all of this, it is very important that a healthy dentition is maintained by our aging adults. So the World Social Report 2023 states that there should be no one left behind in this aging population, and that everybody should be taken care of, be their general health, be their oral health. And there are guidelines that have been put forth in place. And again, it has been stressed the importance of maintaining the natural teeth. So when we look at the natural teeth, it has to be maintained from a structural, function, and psychosocial point of view. The number of teeth that are present in the mouth is a predictor of the mortality, irrespective of the socioeconomic status and lifestyle and the health factors that are there. Adequate nutrition is a vital factor in promoting the health and well-being of an aging adult. Inadequate nutrition may contribute to an accelerated physical and mental degeneration. Disorders of the oral cavity contribute to poor eating habits, which in turn is detrimental to the nutritional status and health of the patient. Loose, painful teeth, ill-fitting dentures, oral lesions, dry mouth may result in the reduced desire or inability to eat, leading to lean body mass and lower exercise levels. So inadequate food intake with painful issues of the teeth can result in turn with inadequate food intake to inadequate calcium, iron, and other supplements, leading to anemia and osteoporosis, what we see in women. And sometimes being homebound because of multiple health issues, there's an insufficient vitamin D levels, which again is a precursor to good health. Now, oral health and general health are closely linked. The common risk factors that we see are because of the presence of old restorations because of the presence of old prosthesis in the mouth. There's gum recession. There is less salivary secretion that happens with age. There is less muscle tone. There is an altered taste sensation. There is mucosal atrophy. That is, the inner cheeks tend to get atrophic. The teeth get worn out, as a result of which there is a loss of vertical dimension. That is, sometimes patients complain of jaw pain, closing and opening, because there is a wear of the teeth and the bite tends to get worn out. So in all this scenario, it is important that we pinpoint as to what the problems are and we promote a healthy dentition among the aging population. Now, chewing activity should not be taken for granted. It is something that causes, chewing activity causes a rhythmic movement that improves the blood flow to the brain cortex, and this helps in maintaining the cognitive function of the brain. Importance of natural teeth are that it supports the crowns, it supports the bridges, it supports overdentures, removable dentures. The very fact having natural teeth helps to maintain a proprioception. That means when the food is put in the mouth, you know the amount of pressure that you have to use to chew the food on, to understand and taste the food, whether it is hot, cold, and accordingly chew the food, make it into a bolus, swallow the food, and thus help in having your improved nutritional status. Now, when you have broken down teeth, your oral appearance also takes a beating. It also leads to bad breath, and all this can also lead to an impeded social interaction. Now, what are the common problems that we see in the oral cavity in the aging population? It is many a times increase in the cavities. Now, as age progresses, the chewing surfaces of the molars many a times tend to become flattened. But at the same time, there are gaps that are there between the teeth, and food tends to get lodged over there. And if proper care is not taken, it leads to cavities at the contact areas of the teeth. Also, when the gums tend to recede and the gum health is not maintained properly, plaque remains around the roots of the teeth, and this in turn leads to cavities of the teeth. So there is an increase in cavities even in the aging population. Restorations, crowns done in the early ages, that is in the second, third, fourth decade, if unattended, again, there is a tendency for plaque to accumulate, leading to secondary caries around the existing restoration. So even in the aging population, there is always an increased tendency for cavities in the teeth. So it can be on the sides of the teeth, it can be on the root surfaces of the teeth. Sometimes there's a total breakdown of the teeth because of certain conditions like xerostomia or radiation caries, which I'll come to later. What we see is the dryness in the mouth in the aging population. As I said, 55% of the population suffer from some illness or the other. 27% have two or more comorbidities, as a result of which there is something known as polypharmacy, that is multiple medication being taken by the patient. I will answer the questions later. Please put it in the chat box. So in such scenarios, when there are multiple medications, there is a tendency for less salivation, a tendency towards dryness in the mouth, where the mucosa within the mouth can get ulcerated, the lips tend to be cracked, the tongue tends to be fissured. Also, what we see in the aging population is the gum health. The teeth tend to become loose, there is inflammation of the gums, and the gum recession, what I was talking to you about. Now, with age, the chewing surfaces tend to wear out, what we call as attrition. Also, the sides of the teeth can wear out, which we call as abrasion. And sometimes, because of the consumption of acidic food or because of gastric issues, there could be erosion of the teeth, again making it very sensitive to hot and cold. And also, to add to all of this, because the manual dexterity decreases with age, the tendency to maintain a good oral hygiene also reduces. So it becomes a cyclic thing. The oral hygiene not maintained, the tendency towards oral health issues tend to increase, be it gum disease or be it decay around the teeth. Now, mean, routinely, every adult should visit a dentist once in 6 months for sure. Now, when you visit a dentist on a routine basis, it is easier for the dental professional to point out the problem. So, when we talk about cavities, if it is at the initial stages, it can always be prevented with the help of certain remineralizing paste or maintaining a good oral hygiene, that is, brushing your teeth, flossing your teeth, using interdental aids. That itself will prevent further progression of the cavity. There are many fluoride paste, gels, varnishes that are available in the market today, and using these on a regular basis also will help in the reduction of the plaque and the bacteria around the teeth that cause the cavities. There are, apart from fluoride toothpaste, there is something called as amorphous calcium phosphate or casein phosphopeptide derivatives. Now, these are called as remineralizing paste. These, when examined by the dentist in charge, if there is a tendency towards increased cavities or increased demineralization of the enamel, this is prescribed to you to be done as a one application over a period, one day, on a daily basis application for a period of 2 to 3 months, so that the enamel gets strengthened and the tendency towards the cavities reduce. In patients who have high bacterial counts in the mouth, there are chlorhexidine based gels and varnishes available to reduce the bacterial concentration, thus, the risk for cavities also reduces. Now, in patients who have less salivation into their mouth because of medication or because of certain other health issues, salivary substitutes are available, which improves the hydration, lubrication, and helps in self cleaning of the mouth. Now, this is for initial cavities. Now, when the cavities are extensive, then it is better to get restorative treatment done. Today, there is a whole lot of restorative materials that are available. They are strong, they are long lasting. Some of them release fluoride, and it is better that the restorative procedures are done. Sometimes endodontic procedures, that is root canal treatment, is done with crowns so that these broken down teeth can be maintained back to a healthy state and the function of the teeth are maintained. Now, xerostomia. Xerostomia means dryness of the mouth. Now, we see this in almost 30% of the patients who are 65 years and above, and 40% of the patients who are 80 years and above. And as I said before, most of it is because of polypharmacy, that is, the patient is on multiple medication. Now, the medication cannot be stopped because that is to improve your general health. But maintaining your oral cavity in a situation like xerostomia is what I'm coming to. Now, usually, a patient always feels parched in the mouth. These patients are always recommended that to sip on water every 1 to 2 hours. But minding, there are some patients who have kidney issues and they have certain restrictions not to consume more than 1.5 liter of water a day. So, keeping all those limits in mind, if you sip onto water maybe 1 to 2 hours, that will by itself hydrate the mouth. One should limit the use of alcoholic beverages or beverages high in sugar, caffeine, juices, soda, tea, coffee to reduce this tendency towards xerostomia. Many a times, xerostomia is not just about dryness, it is because with fissured tongue, cracked lips, and there is a parchness and the mucosa tends to break down. So there are certain gels, hydrating gels that can be applied on the mucosa. If you see, it's available with the chemist, it's available online. Good products available. Apply 3 to 4 times in the inner mucosa and keep your mouth hydrated well. This is apart from using a hydrating mouth. Now, why one needs to take care of xerostomia is because there is dryness, there is less salivation. The plaque that builds up around the teeth have bacteria in it, and that can cause multiple cavities. Now, when there are patients who are not aware about their xerostomia condition and they come to us, it's like practically every single tooth, every single surface of the tooth is decayed, and the patient many a times is symptom free. That means the patient doesn't have any complaint. Maybe he or she feels that there is some black areas in the mouth which are all around. So in such patients, extensive treatment in the form of restorations are done. Sometimes we have to do endodontic interventions, but all these teeth can be preserved. But treating these teeth just by doing restorations and crowns is not an answer. Along with that, trying to hydrate the mouth is very important. Maintaining a good oral hygiene is important. Brushing twice daily is important. And there are certain fluoride applications done by the dentist to prevent further decay in those dry areas of the mouth where restorations are inaccessible in such situations. Along with this, there are chewing gums which are sugar-free, xylitol chewing gums, which a patient is advised to chew on to stimulate the salivation. Sometimes we prescribe the patient vitamin C lozenges like Lindsay, Juicy, and all those things. The minute it's chewed in the mouth, there is a certain amount of salivation that occurs, which hydrates the mouth and makes the patient comfortable. Now, coming to radiation caries. Now, there is an incidence of cancer in our country, especially head, face, neck cancer, which is on the rise. Such patients, apart from surgeries, chemo, undergo radiation therapy. And many a times when radiation therapy is done, the maxilla, the mandible, and the salivary glands are affected. Now, in such situations, what happens is that over a period of time, we see that the enamel, that is the outer covering of the tooth, tends to get altered and they tend to become brittle, and there is a breakdown of the enamel. Many a times, this leads to cavity formation. There is simultaneous xerostomia or dryness in the mouth. There is plaque accumulation, patient unable to clean, and results in cavities around the edges of the teeth, which are extensive, or because of the breakdown and the chipping, even on the chewing surfaces that is seen. Now, ideally, a person who's undergoing radiation therapy because of cancer should visit a dentist, get a kind of a dental clearance. That means if there are any existing problems in the dentition in terms of the gum health, in terms of cavities, they should be restored. A good oral hygiene should be maintained. Patients should take the advice from the dentist as to how to maintain the oral cavity when the therapy is on. Also, the dental professional many a times gives a fluoride application to strengthen the enamel, so the breakdown of the enamel is comparatively less. During the phase when the radiation is on, see to that the person is always using a fluoridated toothpaste that strengthens the enamel surfaces. And as I said before, salivary substitutes are available in case dryness sets in because of the radiation that is given. Remineralizing paste like GC Mousse is one of the trade names that I'm giving out. These are casein derivatives of calcium phosphate. These are very good remineralizing paste, which when used on a daily basis, again helps in strengthening of the enamel. But in spite of this care, sometimes when the breakdown is quite extensive, please visit your dentist. And there are certain adhesive restorations that have fluoride releasing properties that should be used as restorative materials, and the teeth should be restored so that they don't break down. Because if it leads to breakdown, many a times when radiation is on, the doctor will not even give a consent for an extraction or further comprehensive treatment. So it is always best to have preventive treatment in place and maybe early interceptive treatment to prevent further breakdown of the teeth. Now, this is another area where patients on bisphosphonates. Now, there are patients who suffer from breast cancer, prostate cancer, multiple myeloma, and have bone metastasis, and they are prescribed this particular medication called as bisphosphonate. These are basically an anti-resorptive therapy that is given to a patient who suffers from cancer. Apart from that, a low dose of anti-resorptive therapy medications are given orally or as injectable, maybe every 6 monthly, in patients with osteoporosis. Now, osteoporosis is something that is seen in women around from menopause onwards. 60 plus is very much on the rise, especially in our country. And these are medications prescribed by the orthoped surgeons, because many a times patients go to the orthoped with multiple falls, spine fractures, and apart from the treatment method at that point in time, to prevent further, this kind of medication is also prescribed to the patient. Now, when such a person visits a dentist, it is very, very important that they disclose the kind of medications that the patient is taking, because many a times, it's taken for granted. I have osteoporosis, and that has not much of correlation with my teeth and with my mouth. And sometimes it slipped by. And it could be a little dangerous if you do not come forth and tell the dentist, because if it is a simple restoration or cleaning, the patient doesn't have a problem. But if a patient has to undergo extraction or surgical procedure and the patient is on these kind of medication, there's always a tendency that post-operative it leads to a kind of necrosis of the jaw, and it takes a long, long time to heal. So if you are on medication like Osteophos 70, Prolia, Xgeva, Fosamax, Boniva, Zomata, Reclast, please mention it to your treating dentist or physician, because in all such situations, the dentist immediately knows what kind of care has to be given to you. And ideally, if a patient, say for example, a patient on Prolia, like I had a patient just 2 days ago, it was her sixth dose of Prolia. And she makes it a point that every time before she takes the Prolia, she comes to me, gets a checkup done, a cleanup done. If there are any early restorations to be done, we sort all of that out, and then she goes and takes the injection. Now, there are situations where the patient has a problem and may need an extraction, but is on one of these medications and cannot be done 1 to 2 months immediately after the medication is taken. So, in such situations, we prescribe the patient medication in case if he or she is in pain till such time 4 to 5 months have passed since the earlier dose was taken, and with the physician's consent, the needful dental treatment is done and before the next dose is taken. But tablets are less potent, like osteoporosis, if taken on a weekly basis. But yet, one should tell your treating dentist, because many a times after the dentist speaks to the treating physician, the doctor always says, wait for 3 to 4 weeks. We will stop the medication for some time and then only pursue with the dental treatment. So please do not take it for granted when you visit a dentist and you have an underlying condition. Do not think that these do not have a bearing in the mouth. It is very, very important that you have an open relationship or take your prescriptions to the doctor so they go through everything and can give you the needful treatment. So, coming to the end, what I have to say is that, especially for the aging adult, it's the most beautiful phase of life. You may have health issues, but today, the best of treatment is available. The best of physicians are available in our country. You are aware both with all the media, with the print network, as to what it is all about than what it was 15, 20 years ago. So when we live in such a highly aware period of time, the first and the most important thing is that we take good care of our teeth, understanding that it is as important as the rest of the body, and that having a good oral cavity means we are also preventing problems occurring. Say, for example, if you have an improper oral hygiene and you have cardiovascular issues, the bacteria that are there in the gums through the bloodstream can go towards the cardiac tissue where you undergone a stent or procedures like that, and can cause something known as endocarditis. So it is so very important that a good oral hygiene is maintained in such situations. Or say, for example, diabetes. Now, if you have diabetes is so very common in our country. If the oral hygiene is not good, the gums tend to have something known as chronic periodontitis, a chronic gum disease. And this in turn results that your sugar levels go high. So if you have a good oral hygiene, your gum health is good, even your sugar levels are maintained well. If your sugar levels are not maintained well, if there is an infection in the mouth, it translates to a abscess, which takes a long time to heal. So it is a bi-directional thing. Maintaining a good oral hygiene so that your general health is good. Maintaining your general health is important so that even your oral health remains good. So maintaining a good oral hygiene is very good. Say, for example, in patients who have COPD. Now, in such, sometimes the patient tends to have pneumonia and is bedridden. And if the oral hygiene is not good, the bacteria level that is there in the mouth can also prevent an early healing of situations like pneumonia. Now, there are studies that have been done and that have shown that people who are homebound, bedridden, people who are in institutions, because their oral hygiene is not in good shape, they have a higher tendency towards pneumonia because of the bacteria present in the mouth that go to the lung, and that is how the tendency is higher. So, maintaining an oral hygiene, again and again, I emphasize, is very important for the general health of the person. Brushing your teeth twice daily. As I said, there is a less over a period of time, the tendency, the vigor reduces with age in brushing. Maybe in the ideal 3 minutes, it's not done. It's done for a minute or two, and food remains stagnated between the mouth, and that leads to multiple cavities and things like that. All this can be prevented if at bedtime you brush your teeth, you gargle, use a mouthwash, and keep it in optimum condition. Your general health, your oral health, everything will be great. Apart from brushing, as I said, there are chlorhexidine based mouthwashes, there are fluoride based mouthwashes, which help considerably. Flossing your teeth, there are interdental aids, fine toothbrushes that go into the gaps between the teeth. So, whatever food is stuck between the teeth, if you're not able to remove with the help of a toothbrush, using these interdental aids will definitely help. Now, some patients have difficulty using these interdental brushes. There's something known as a water flosser or a water pick. So it is like a jet water spray from a bottle. Now, if you hold that against the gaps between the teeth, against the different prostheses that you have in your mouth, and remove the food that is accumulated, the tendency towards the gum breakdown will be considerably less. Use of a fluoridated toothpaste or a desensitizing toothpaste or a remineralizing paste have its own positive benefits. So use that on a regular basis. Sipping onto water, very important. Yes, at bedtime, do not consume too much of water because otherwise, again, the tendency towards going to the toilet at night is much more, which again can lead to accidents. But through the day, if you hydrate by sipping onto water, you need not have enough more than a glass of water at bedtime. Maintaining a balanced diet. Now, many of the patients, what we see, are very socially active. So, unknowingly, there is an increased intake of carbohydrates, increased intake of sugar, which should be kept in check. A balanced diet with more of fibrous food in the form of fruits, vegetables is much more healthier than embarking onto having sweetened carbohydrate based meals. So these are the general things that one should take care so as to have a good oral health, because a good oral health in turn will translate to a good general health, and a good general health will also translate to a good oral health. Before I end, I have few words for people who are homebound and in institutions. They need help on a daily basis for their activities, and the caregiver who is looking after these patients should see to that they brush their teeth twice daily, or do the caregiver should himself or herself go about and brush the teeth. See to that they gargle well after meals, because food again getting stagnated into the mouth can lead to bad odor, lead to breakdown of the teeth and multiple cavities. And such patients find it difficult to seek dental treatment. So maintaining the mouth on a day-to-day basis is more important than seeking out comprehensive care. And in dry mouth, especially bedridden patients, ensure that oral lubricants are used so that these patients are comfortable, because sometimes these patients are not able to tell the person, and sometimes they see a bleed coming from the mouth and then they get alarmed. But if you are in touch with a dental professional, of course, sometimes a home visit can be done and the necessary medication can be prescribed. These patients can be kept comfortable. So I hope I have made some sense as to how an oral health has to be maintained. As I said before, aging is the most beautiful time of our lives. Even I'm soon going to be in the geriatric category. But as age progresses, it's not that we have seen a sunset in life and that one should give up, one should enjoy more, but at the same time, one should take care of one's own self, be it our general health or the oral. Thank you so much.
Thank you very much. Thank you very much. I'm going to do a small poll here, which, as we get into questions, uh, this is something that we've not tried earlier, but just asking people this question: how many times do you do
brush your teeth?
Brush your teeth. Let's see if we can get some responses. In the meantime, I will start with questions. Could you put off? That's great. Firoz, will you just check the poll results later? If we get some, it's not something that we've done in the past. So I'm not very sure whether we'll get a good response, but whatever. After quite a few questions that have come in.
Yeah, I'll be happy to take it.
So this is one from Mr. Ravi Gandhi, who's 62 and based in New Delhi. He had a root canal done in 2018 on his top molar, but he did not cap it. So the tooth is now completely broken. His question is, what if I don't do an implant?
See, it's not about what if I don't do an implant. Would you move ahead without a hand or a leg is my question. So when we have 32 teeth, ideally many a times the third molars are missing or some extra. So ideally you need at least 24 teeth in your mouth to chew as age progresses. So if you have lost a molar, you do not realize the importance that the function of your tooth is slowly compromised. One tooth missing into that gap, the adjacent, say for example, it is your upper molar that is broken down. So what happens with time is that the adjacent teeth slowly start moving. Then food gets stuck between the gaps over there. The lower tooth may come upward. Again, there is an alteration in the bite. So these things we at 62, you are young, I would say. So please go ahead, extract, place an implant because that will improve the function of your teeth. And because of one missing tooth, the other healthy teeth shouldn't get affected because the gaps that have happened, the cavities that have formed between the teeth, or the tooth from below which has come supra erupted. And then when you plan to do a prosthetic procedure, this tooth is an interference that you need to prophylactically treat this tooth and bring the bite down. So please do not neglect it. Please go ahead and get the extraction and the implant as advised by the dentist.
Right, thank you. We have a question from Mr. Satish Kalia, who's 78 and he's a diabetic. His question is, what type of cap is recommended or better after a root canal? Is it normal to have some? And his other question is it normal to have some pain in the jaw after a root canal procedure?
See, root canal procedure basically is done whereby extensive decay, we remove the nerve tissue within the teeth so that the entire tooth heals and then the crown is done. Sometimes, in spite of doing the root canal treatment, there could be a literacy around the root of the tooth is called as the periodontal ligament. So when we do these procedures, the ligament tends to get inflamed and that is why you experience tenderness in the tooth. Being a diabetic, sometimes the healing could take a little longer period of time, but it should settle. But once the initial symptom of pain, discomfort, tenderness subsides, then you need to go ahead with crowns. Now, the crowns can be of any kind. See, there are different kinds of crowns. It could be a complete metal crown, it could be a porcelain backed with metal crown. These days, you have metal free zirconia crowns. So, whichever crown you do, the idea of the crown is to cover your tooth totally so that they don't break down and the function of your tooth is restored. So it doesn't matter whether you go in for a zirconia or a regular classic porcelain fused to metal crown or a complete metal crown. As long as the crown is done, well done, tight contacts, that is more important. And it also depends upon your financial this thing, because each of these crowns have different pricing and things like that. So what is comfortable to your pocket is that, but any kind of crown as long as it is done.
Thank you. Those of you who have not made notes of what doctor has said, this video, the edited video, will be there on the Seniors Today website on Monday evening. That is Monday the 4th evening, and you can have a look at the video and recall whatever doctor has said in her presentation, as well as to the responses to our questions. We have a question from Mr. Jawahar Goradia. Sorry, he is 77. He says that he has 3 grinding teeth on the right top jaw. The first cracked, slowly cracks increased, and teeth have broken, leaving roots in the jaw. The left side teeth are good and problem for masticating. Is it possible to have dentures for these 3 teeth?
See, dentures are a replacement for the missing teeth. Now, if you have existing teeth, and if the ones that are broken down totally and only roots are there, they need to be extracted so the denture can be fabricated properly. Because if the root pieces are there and if you want a replacement, the root pieces remain in the gum, the denture will irritate the gum and then you will be in constant pain. Now, if you have even just 3 teeth remaining in your upper jaw, and if they are healthy 3 teeth, the doctor can definitely go ahead and fabricate something like a overdenture or a regular removable denture, because those 3 teeth become the support for the existing denture that can be made. But it all depends on the periodontal health, that is the gum health. The teeth need to be strong enough that they can hold the denture in place. Sometimes these 3 teeth are in such precarious position, in the sense you may find that you're comfortable with it, but with age they get supra erupted. That means they are below the chewing plane, that when a denture is fabricated it becomes an interference. In such situations the doctor may tell you to extract the teeth. So in such situations, please follow the doctor's advice. So there's no blanket rule. It is from person to person, it differs as to how the remaining 3 teeth are in the mouth. Yeah.
Right, thank you. We have a question from Shailaja Ganguly. Her question is there a genetic factor contributing to the state of dental condition?
Yes. So the thing is that, say for example, during the formation of the teeth, there are certain conditions called as hyperplasia, the whereby which is genetic in nature. The enamel quality is not that great, and in such situation, there is always a tendency for multiple cavities. But those we see are less these days. But yes, there is. Now, when it comes to gum health also we can say run in families, that there is a tendency. But the kind of awareness that is there today and what was there 50 years ago, we are way ahead. So we cannot put down to say that I have a familial tendency and that is why my teeth are bad. I wouldn't accept that, because today there is much better care that is available. And if you feel that you have a genetic tendency, then you should be visiting the dentist more often, be more proactive of your gum health. Or if you have a tendency towards cavities, that should be, because cavities are because of 3 factors. It's the presence of food that is there, improper oral hygiene, and the bacterial count that is high. So these are all within the our control. We can brush well, reduce the bacterial count, we can reduce the carbohydrate diet. So with that, the tendency of cavities is always less. But periodontal health, yes, with optimum care, even if there is a genetic tendency, can be kept in check.
This is an interesting question. I've always also wanted to ask why is it that the Indian Dental Association hasn't been able to prevail upon the insurance companies to take care of medical expenses on dental care?
I know in our country, fine. It is not that Indian Dental Association is not doing, it's being done. There are deliberations and there are offers. There are different kinds of packages that are being done. But yes, insurance is still a long way to go in our country. But I also look at it is that maybe insurance is not covering everything, but our dental charges are not that high when we compare it with the West. We get the best of treatment. That if you see today, root canal treatments and crowns that are done in our country and done in European countries or in American countries, it is at par, and we charge hardly anything. And also, I'm not joking. Like there are people do, but there is so much of medical tourism within our country because of the costing factor. It's so very economical. But having said that, in our country, see, we still do not have a social security scheme, and those are the things that we are trying to work. Means I honestly understand what you're saying. You visit a dentist, you have multiple root canals, you have crowns to be done, implants to be done, it can go into lakhs. And for a senior citizen who doesn't have a pension scheme or a social security scheme to suddenly dole out, I mean, I'm talking across the classes. So, or be dependent on to the your children or to break down a fixed deposit. It is not easy, and dental is not the only thing. There are multiple health issues. I truly understand the social security part of it, yes, but I do hope there are changes that will happen in our country even in G20 summit, and all these things were deliberated on. So maybe in next 5 to 10 years, definitely there will be changes.
Fingers crossed on that. We have a question from Mr. Samir Vasavada, who's 66. He says, since the last 5 years, small chips of my 3 to 4 teeth break, regularly leaving only half a tooth. What must be the reason? How to prevent further breaking of edges of other good teeth? He says, no BP, no diabetes, no deficiency of vitamin D3. He regularly takes Calcimax, Forte, and Decosules, vegetarian, no smoking, no alcohol, no acid reflux. He is 66, 5'9", and walks 2 kilometers per day, and he's very healthy.
I'm glad this question has come up because in my talk I never spoke about it. Now what I understand is that there is a condition known as clenching or bruxism. So sometimes, in spite of having a good oral health, there is this subconscious habit whereby we tend to clench our teeth. In our sleep, we tend to grind our teeth, and these result in the wearing of the teeth. So when such kind of wear occur in the teeth, it is not just flattening out. It is that certain edges of the teeth become sharp, and then you bite onto something. Sometimes patients say, I was only eating a idli and my tooth chipped. Well, it could be that there is an unsupported enamel, and that is why the breakdown of the teeth occur. So this is a very common condition. It's because of our lifestyle, the stress. We do not realize about it. We internalize a lot of things, and those are the conditions that lead to this clenching and bruxism. We saw a huge rise in bruxism and clenching during COVID phase because of the stress of being indoors. So in situations like that, please address this problem with your dentist. Today, there are certain guards that are made, what we call as a night guard, a bite guard, which the patient has to wear against the upper or the lower teeth. So when you sleep, it becomes an interface between your upper and the lower teeth, and they protect your teeth from wearing down and from chipping away. A very good question. I'm glad this was brought up.
Thank you. We are already on 5:47. If you can, quite a
Yeah,
few
no
questions
worries.
coming.
I'm glad.
So there's a question from Jankna Modi, who asks, is the use of dental floss on a daily basis from a young age harmful? She's 65. There are gaps between my teeth, between teeth, and she wants to know whether dental floss is okay to use.
Yes, it is the whole idea. Why do we use a dental floss? So when we brush our teeth, we are brushing on the outer surface, the inner surfaces, on the chewing surfaces. But the contact areas between the teeth, they are so tight that the bristles of the brush do not enter the contact areas. So that's where the floss comes in, because you slide the floss into the contact area of the teeth and remove the plaque that is there between those contact areas. Now, because that becomes a point where the cavity starts, what we call as proximal or the contact cavities. So the minute you remove the plaque, you reduce the bacterial count, and that is how you protect these surfaces from getting cavities. Now, what happens is that when you floss on a day-to-day basis, the plaque is removed, your gum health is maintained. You feel that at the gum level, the gaps are there between the teeth. It is not that the gaps have increased because of the flossing. It's that because your teeth are in a healthy state, you can actually see the gaps between the teeth. So flossing I mean, this is something in our country where from a young age, our youngsters have to use it on a day-to-day basis. The awareness is not that high, but still, yes, things are much better today. But if in your family, if you advocate the use of a dental floss for yourself and for the rest of the family, it's a wonderful habit. Now, when the gaps are bigger and the contact areas are like slightly open, the floss doesn't help much. So that is where the interdental brushes come. They are fine bottle brushes that go into the gaps between the teeth, where you can push it in a horizontal manner, remove the plaque that is there, and that's how maintain the contact areas of the teeth in a healthy state.
Thank you. We have a question from KG Daranchi, who asked, Doctor, is it better to use Ayurvedic toothpaste as compared to our regular paste which contain fluoride for us seniors?
See, Ayurvedic toothpaste, I have nothing against it, but we need fluoride on a day-to-day basis to strengthen our enamel. So if you are a person who wants to use herbal products, what I tell my patients is that use it once a day, but use a fluoride toothpaste also once a day. So you can use the Ayurvedic toothpaste in the morning and use a fluoride toothpaste at night. Sometimes some of these fluoride Ayurvedic toothpaste, they cause staining of the teeth. I don't want to name any of the products, but yes, suddenly you see that your teeth are becoming brownish in color. It's because of certain products, certain ingredients that are present in the Ayurvedic toothpaste. So please do not use a herbal toothpaste alone. Use it along with a fluoridated toothpaste so that a check and balance is maintained.
Great. Thank you. We have a question from an anonymous attendee. I think you've answered this. Which is the best crown? She needs a root canal. She's 78. Uh, you have answered this question about which is the best crown. There's somebody who wants your contact details. I think we'll put it up on the takeaways when we put it up on Monday. There's one question which is there is till what age can one go for an implant safely?
If you have good health, even at the age of 94. So we have a patient who has good health. She needs a little support these days to come to the clinic. She comes with a walking stick. So she's been with us for the past 20 years. So I've been seeing her since the time she was 74. And she had many implants, and suddenly the front teeth were her natural teeth. And one day while playing bridge, she ate onto a cookie or something, and the tooth fractured. And this was on a Saturday evening, and she called up in emergency. I need to talk to you. And I said, okay. So she said, I cannot go on Monday to play my other game. You have to do something for me. So 9 in the morning, Dr. Narvekar, myself, we saw her and we said, I'm sorry, we cannot do any quick fix either. So we both were hesitant about telling her to get implants done at 94. So she said, what are my options? We said, complete denture or then implants. She said, I'll go for what is fixed, and that's an implant. So she's almost at the completion of it. So even at 94, if you have good health and if you are positive in life, you can get it done. Good health, and your bone health has to be good. That's all.
Right. We have a question from Girija Ganesh, who's 64. She says, recently I heard a doctor say senior citizens should avoid using toothbrush and use finger to brush and massage the gum too in the process. And she heard saying that toothbrush removes the enamel as you age and makes the teeth sensitive. Please clarify.
See, if you use a toothbrush there are different kinds of bristles. There's soft, medium, hard. So avoid using toothbrushes with hard bristles that could be harmful, especially in a situation, say, for example, you have a gastric problem whereby you have an issue of demineralization of the enamel. You don't realize it. You're using a hard brush that can tend to chip away the enamel. Or you have an existing gum disease and it hasn't healed well, and you use a medium sized toothbrush or a medium bristle toothbrush or a hard bristle toothbrush, in such situation it again irritates the gums. In such situations use a soft toothbrush. So I wouldn't say that don't use a toothbrush. A toothbrush has to be used. There is no replacement to your fingers because the fingers cannot remove the plaque. Plaque is a tenacious layer that is there on the tooth, which your fingers will not remove. So a toothbrush is important. Along with that, fingers can be used to massage the gums, which is very important. Say for your upper jaw, when you're massaging the gums, you can go round and pull it downward. For the lower, you can go down and pull it upward. All that is fine using finger motions, but no finger cannot replace a toothbrush. But the bristles of the toothbrush, depending on the situation, can be soft, medium, not hard.
There's a question from Mr. Rajiv Kumar who asks, there are electrical toothbrushes. Are they available in India? How are they?
Good. Electric to power toothbrushes are good. I would recommend that. You have a circular head, you have rectangular head, depending on how your teeth are placed. Say for example, your molars and all those things, your cheek, how it is falling against it. If you have round circular heads, you can easily put the bristles of the brush way behind and maintain that. The advantage of using a power brush is that you do not have to go around and do the circular motions and angulate it up and down. Hold the brush against the surface of the teeth and that does the job. So in patients who have less dexterity of their hands, can always use a power brush.
Doctor, there are just so many questions, but I'm going to just stop it at this one. This is a lady who's not given her name. She's 75. She says there are gaps between my teeth. How do we remove the food on a regular basis? And she also says that my gums always get inflamed due to chilies. What should I do?
Yes, yes. Gum, and that is again very, so there is a condition known as submucous fibrosis, and in our country we have a tendency to have a lot of whole spices. I'm not talking about just green chilies. We have whole spices in our diet, and especially chilies. The content in the chili tends to cause burning sensation of the mouth because the mucosal layer of our inner cavity and the gums tend to become a little worn out, and that is why that burning sensation occurs. Now you have a situation like this, please avoid chilies for at least 3 to 6 months. Visit your dentist close by because there are certain antioxidants that are prescribed to the patient that improve the condition, and certain applications if it is very painful.
Great. Thank you very much for being here. We've answered so many questions. Very detailed presentation. As always, good to have you here. Uh, we will be uh, uh, putting up this video on our website on Monday evening, so you can please have a look at it. And those of you who missed the session can also record the points that she's made, Dr. Narde has made, and benefit from there. Thank you very much once again for being here, for answering so many questions. And we will be back once again
I'm
next
glad.
Saturday. Thank you very much. Next Saturday at 5 p.m., we will be having a session from an ophthalmologist next week on glaucoma. So please be there in case that's a topic that interests you, or you know somebody who would be interested. Please refer them to our session. You can always join the session. There's a pre-registration form which is there in the chat window. You can register there, and of course, keep reading our content. There is the Seniors Today magazine, which comes out every month on the 15th of the month. There is the daily newsletter, which is updated every day, and plus we have the Evergreen Club app, where you can also attend a lot of our shows, and we have a variety of shows. We have, but there's somebody who's attending here, Anita Dikshit. Rakshit, who does a show on yoga and meditation. And there's music, of course. The Seniors Have Talent, which has gotten to the 14th season now, and a host of things happening. So enjoy the experience, enjoy the Seniors Today experience that we present every day of the week. Thank you very much once again, Dr. Narde. Thank you very much.
Thank you so much. It was indeed